You ever feel like you're doing everything right for your health? Eating clean, exercising, but something's just off? Well, today we're going to dig into a nutrient that might just be that missing piece, iodine. We'll be looking at the work of Dr. David Brownstein, who makes a pretty compelling case that this one element is at the heart of a huge hidden health crisis.
So let's just dive right in with a single, kind of shocking number that comes from Dr. David Brownstein's clinical work, 97%. What in the world could that be referring to? Get this, that's the percentage of his patients who turned out to be iodine deficient. And we're not just talking a little bit low. Nope, the vast majority were significantly deficient. And that's exactly why Dr. Brownstein calls it a modern epidemic. It could be the very reason so many of us can do all the right things and still feel like we're not getting where we want to be with our health. Okay, so what actually happens inside your body when a gland is starved of iodine? Well, you can think of iodine as the master architect for all the glandular tissues. We're talking thyroid, breasts, prostate, you name it. Its main job is just to keep the structure of those tissues healthy and normal. So what happens when the architect doesn't show up for work? The whole building starts to fall apart. This right here, this is the path that Dr. Brownstein's research lays out. And honestly, it's a pretty sobering thought. He argues that a simple deficiency can kick off a really dangerous domino effect. You start with perfectly normal, healthy tissue, but without enough iodine, cysts can start to pop up. If that deficiency keeps going, those cysts can then turn into hard nodules. From there, you can get to hyperplasia, which is basically a state of abnormal cell growth. And that is considered a direct precursor to cancer. And here are the real-world results of that continuum, according to Dr. Brownstein. He connects the dots, drawing a straight line from our dropping iodine levels to this explosion in glandular diseases. He points out that as iodine has vanished from our diets, the rates of thyroid, breast, and prostate cancer have just soared to what he calls epidemic levels. And if those statistics don't quite hit home, this quote from Dr. Brownstein really puts a human face on it all. I mean, after decades of practice, he's seen this terrifying shift. Diseases he used to see in much older patients are now tragically hitting people in their 20s. It's a really powerful statement about his belief that something fundamental in our health has changed. So this all leads to the big question, right? Why is this happening? How in the world did we get so deficient in the first place? Well, according to Dr. Brownstein, it's not just one single thing. It's what he calls a modern double whammy. This chart really shows you the two sides of this coin. On the one hand, our iodine intake has been slashed by more than half over the last 40 years. But at the exact same time, our exposure to toxins that actually block the iodine we do get has just gone through the roof. It's a perfect storm. We're getting way less of what we need and way more of what gets in its way. So, how does this blocking thing actually work? Well, it all comes down to some basic chemistry. You see, iodine is part of a family of elements called the halides. Two of them, as you can see, are essential for us, iodine and chloride. But two others, fluoride and bromide, are basically toxic imposters. And because they look so similar on a chemical level, they can sneak into our body's iodine receptors and just sit there, blocking the real iodine from getting in. And these blockers, they're everywhere. Bromide is a huge one. It's used as a fire retardant, so it's in our furniture, our carpets, our electronics. It's been used in some soft drinks and even in commercial bread and flour. So you see the problem? At the very same time our iodine intake is plummeting, our exposure to its direct chemical competitor is higher than it's ever been. All right, so if our food is depleted and our environment is kind of working against us, what's the answer? Dr. Brownstein's work points to supplementing, but he's really clear that you have to be smart about it. You can't just, grab any old bottle of iodine off the shelf and expect it to work. Now, this is one of the most important parts of his whole protocol. Not all iodine is the same. As you can see here, our bodies actually need two different forms. The thyroid gland, it primarily wants iodide, but other glandular tissues, like in the breasts and the prostate, they need iodine. So to really nourish your whole body, he argues that you've got to have a supplement that gives you both. But even if you have the right forms of iodine, there's still another problem, actually getting it inside the cell. And that's where this little guy comes in, the sodium iodine symporter.
The best way to think about it is like a taxi service, just for iodine. But this taxi doesn't run on gas. It runs on sodium. For every 1 atom of iodine it wants to carry into a cell, it needs 2 atoms of sodium to power the trip. And that, my friends, is where salt comes into the picture. It's really simple. No sodium, no ride. The iodine literally gets stuck outside the cell, unable to do its job. This is why Dr. Brownstein hammers home the need for unrefined salt. We're talking Celtic sea salt, Himalayan salt, the kinds that are packed with minerals. He draws a huge contrast with regular table salt, which he basically calls a stripped-down, processed chemical that's more harmful than helpful. Okay, so what does all of this mean for you? Let's try to boil down Dr. Brownstein's whole clinical approach into a few key, actionable takeaways. So here's what his holistic approach looks like in a nutshell. First, the dose he typically finds works for adults is around 25 milligrams a day. Second, the supplement has to have both iodine and iodide. Third, getting enough unrefined salt is totally non-negotiable. You need it for absorption and to help your body detox those nasty blockers. And finally, and this is the most important point of all, this is not medical advice. He stresses that this has to be done as part of a complete health program, and you should always be working with a healthcare provider who is iodine literate and knows what they're doing. So we end right back where we started. In a world that's so focused on diet and exercise, it's a really powerful thought that for so many people, the real missing piece of their health puzzle might just be this one single essential nutrient. Thanks for joining us on The Explainer.